Welcome to the first monthly coding video in a series provided by Prism Vision Group. I'm Joy Woodke, the Coding and Practice Management Executive at the American Academy of Ophthalmology. Today, we are going to be focusing on comparing the E&M Level 3 versus the Level 4, and specifically reviewing glaucoma and dry eye syndrome case studies. As a reminder, to meet the E&M documentation guidelines that were implemented January 1st, 2021, document a medically relevant history and exam as determined by the physician. The level of E&M is determined by medical decision-making or total physician time. For the purposes of this video, we will be discussing medical decision-making. We will be using your charts as examples and discussing key documentation guidelines that contribute to the overall medical decision-making and the level of E&M. Here is our first case study for glaucoma. The reason for visit, as documented, is an IOP check. The patient is noticing decreased vision and struggles at night. She also has been experiencing headaches. The chart documented a medically relevant exam and the patient was not dilated. A visual field was performed and a test interpretation was included in the documentation. The problem assessed at the encounter today was high-risk glaucoma suspect, and the condition is assessed as stable in both eyes based on both the IOP and visual field. The plan is to return in 6 months for a full exam with disc photos. Let's review the overall medical decision-making, or MDM, for this case study and the level of E&M. As a reminder, we must meet or exceed the same level of complexity in 2 of 3 categories for the final MDM. The 3 categories are problem, data, and risk. For this visit, the patient was seen for a glaucoma check. The problem, as documented, would be considered 1 stable chronic illness, or low. Although a visual field was performed, this test would not count in the data category, as a test that has a CPT code and is separately billable does not count in this category. For the risk, the plan was to return in 6 months with a full exam and photos, or low risk. 2 of 3 categories are determined as low, and this is the overall MDM. The E&M code would be an established patient level 3, or 99213. Let's take a look at the Academy's final determination table for medical decision-making, and you can see here with the problem category, 1 stable chronic illness is categorized as low MDM. The risk of complications would also be considered low, and as we look down that column, we can see that we would bill a level 3, and in this case for the established patient, a 99213. Here is our next case. An established patient is seen for a comprehensive exam and a 6-month IOP and glaucoma check. The patient notices their depth perception is not as good as it used to be and is struggling at near. The distance vision is stable. A medically relevant comprehensive exam was performed and additional testing included an optos in both eyes. The assessment includes primary open-angle glaucoma, moderate in both eyes. The IOP is good. Intermediate dry AMD in both eyes was assessed and AREDS 2 supplements recommended. Pseudophakia was also noted. There were no prescription medications. The plan is to return in 4 months for an IOP check and visual field and optic nerve OCT. For this case, we have a comprehensive exam with 2 stable chronic illnesses and a moderate level of problem. There's no relevant data. The risk is based on the return in 4 months for an IOP check and testing, which would be considered low. Note that recommending the AREDS 2 would not count as prescription drug management. So the overall medical decision making would need to meet or exceed 2 of 3, which for this case would be low. And the final E&M code for the established patient is level 3, or a 99213. Here is how it would look on the final determination table. So our problem, as outlined with 2 or more stable chronic illnesses, would be considered a moderate level problem. However, the risk is considered low. So meeting or exceeding 2 of 3, the final overall MDM would be low, which would then, of course, be the 99213. For our next case study, the patient presents for a glaucoma follow-up and visual field in both eyes. The patient is compliant with drops as prescribed and feels vision is stable. The patient is also status post laser. After a medically relevant exam, the assessment includes open-angle glaucoma in both eyes with progression in the left eye. Also noted for prescription drug management, a glaucoma drop is discontinued and a new medication is then prescribed. So here is how we would assess the medical decision making. This is a follow-up exam and check for glaucoma. The problem is one chronic illness with progression, which would be considered moderate. There's no relevant data. The risk would be the prescription drug management, which would be considered moderate. So meeting 2 categories at the moderate level, the overall MDM would be moderate. And the corresponding E&M code for the established patient visit would be the level 4, 99214. And here's how it looks on the final determination table with our 1 or more chronic illnesses with progression, which would be for the problem category at moderate level, and then the risk of complications, prescription drug management, both discontinuing and starting a new prescription drug. And the final E&M code as shown at the bottom would be the level 4, 99214. The next case study is a new patient that complains of issues with dry eyes, including tearing. Artificial tears are used daily, but symptoms are worsening. At the end of the day, the eyes feel tired. A medically relevant exam is performed and the assessment includes keratoconjunctivitis, and the recommendation is to continue artificial tears. Also assessed is meibomian gland dysfunction on all 4 lids, recommending along with the artificial tears other over-the-counter treatments. The patient is to follow up in 5 to 6 months for a dry eye evaluation and LipiFlow in 7 to 8 weeks. So for this case, we have a new patient being evaluated for dry eyes. And the problem is one undiagnosed new problem with uncertain prognosis. That would be considered a moderate level of problem. There's no relevant data. For the risk category, return in 5 to 6 months for a dry eye evaluation and 7 to 8 weeks for LipiFlow. Now this would be considered a low risk. Also, the artificial tears and over-the-counter treatments would not count towards prescription drug management. So to meet at least 2 of the categories, the overall medical decision-making would be low. And the E&M code would be a level 3 new patient 99203. And here's how it would look on the final determination table. So the problem would be one undiagnosed new problem with uncertain prognosis at that moderate level, but the risk of complications would be considered low. So the overall MDM would be the level 3, 99203. The next patient is seen for an established patient comprehensive exam and evaluation of dry eye syndrome in both eyes. The patient complains of trouble seeing signs worse at night and driving. There is eye pain mostly in the right eye and tearing. The patient is currently prescribed Restasis. Following the medically relevant exam, the assessment is dry eye syndrome in both eyes, continue Restasis and tears, and a new eye drop is prescribed. The follow-up is in 6 months for a comprehensive exam. For this scenario, an established patient was seen for dry eyes, and the assessment of the problem would be considered one chronic illness with progression as documented in the chart. This would be considered a moderate level of problem. Now, there was no relevant data, and for the risk category, we had a follow-up of return in 6 months for a comprehensive exam and also prescription drug management, both with continuing and adding a new prescription drug. So with the prescription drug management, the level of risk would be considered moderate. And we have met 2 categories at the moderate level, and that would be the overall MDM. And that would be an E&M code level 4, and for the established patient, a 99214. And here is how it would look on the final determination table with one or more chronic illness with progression, along with the prescription drug management, clearly meeting 2 categories at that moderate level with a final E&M code of a level 4, 99214. Our final case is an established patient being evaluated for both glaucoma and dry eyes. The reason for a visit is an IOP check and evaluation of KCS. The patient states vision is okay, but thinks it's getting gradually worse, and the patient is compliant with eye drops as prescribed. Both primary open-angle glaucoma and keratoconjunctivitis are assessed. The IOP may be high and an eye drop is discontinued and a new drop is prescribed. The plan is for the patient to return in 6 to 8 weeks for an IOP check and additional testing. Now let's consider the overall MDM. In this case, the glaucoma was worsening, so that would be considered one or more chronic illnesses with progression, a change in eye drop management. But even if the glaucoma was stable, we would have considered 2 or more stable chronic illnesses that were addressed at the encounter today. Along with the prescription drug management would be an overall meeting of 2 categories, which would meet that moderate level and the final determination of an established patient level 4, 99214. Here are the key takeaways from this session. As a reminder, meet or exceed 2 of 3 medical decision-making categories to determine the overall MDM and the final E&M level of service. Next, the chief complaint, along with the reason for visit, establishes the medical necessity of the exam. Only include the problems that are assessed at the encounter today, not necessarily the patient's entire problem list, just the medically necessary problems addressed during the encounter. Make sure and assess each relevant problem as stable, worsening, progressing, as appropriate, and include a plan and follow-up for each problem addressed as this establishes the medical necessity of the follow-up visit. And finally, for any medication prescribed by the physician, whether documented to continue, change, discontinue, or add, would meet the moderate level of risk category. And as a reminder, over-the-counter medications, including AREDS2 or artificial tears, would not count as prescription drug management. Thank you for joining me today for this focused review of E&M Level 3 versus Level 4. The next monthly coding video, as provided by Prism Vision Group, will be released soon.